My name is Dr. Leslie Anderson, and I'm a psychologist and training director at the UCSD Eating Disorder Center. I'm a part of the DBT workshop that we're doing at the conference. We have multiple presenters who are going to be talking about some advancements in using dialectical behavior therapy to treat eating disorders. This is something that we've been doing for years, and there's burgeoning research on how effective this can be for people with eating disorders. DBT was originally designed for patients who have pervasive emotion dysregulation, and they need to learn skills to help regulate their emotions. That is often the case with eating disorder patients as well. They have ended up turning to eating disorder behaviors as a way to regulate their emotions, and we're teaching them DBT skills to regulate their emotions without depending on eating disorder behaviors. We're really going to outline some of the newer developments in the field. So we're going to be talking about Radically Open DBT for our over-controlled eating disorder patients. We're going to be talking about prolonged exposure for trauma for patients that have both emotion dysregulation and trauma in their presentation, as well as an eating disorder. And then we're going to be talking a little bit about using exposure techniques for emotions. And I think this is one of the areas of DBT that often gets neglected. So I'm very excited about going more into detail with that. I'm excited to present with Dr. Juliana Gorder, who is a psychologist at the UCSD Eating Disorder Center, and she's going to be talking about RODBT, Radically Open DBT.
RODBT is a treatment model that was designed specifically for disorders of emotional over-control. There's a growing recognition that too much self-control and too much self-regulation can be just as much a problem as not enough. Over-controlled patients tend to over-regulate and over-tolerate distress. And so you can hear that there are really fundamental differences in the skills that they need to learn in treatment, such as how to be more flexible, how to openly and authentically express their emotions, and how to relax and have a little bit of fun.
Dr. Ann Cusack will also be presenting. She's a psychologist and program manager at the UCSD Eating Disorder Center, and she'll be talking about the DBT-Prolonged Exposure model for patients who have eating disorders and trauma in addition to emotion dysregulation. This is a newer model that's emerged in recent years that is incredibly effective for figuring out how to structure treatment for people who have lots of emotion dysregulation and trauma and an eating disorder. And where do you even start with a patient like that?
In my presentation, I'm very excited to be able to convey how addressing trauma within this population can really be a huge motivating factor for recovery. Oftentimes, clinicians, I think, have concerns that addressing trauma will make our patients' behaviors worse, and in reality, they can be a huge motivating factor. I really just want clinicians to be empowered to be able to provide evidence-based treatments to these very difficult adult populations, because so many lives can be changed in the most amazing way, and I never want clinicians to feel not empowered to be able to provide that treatment.
I'm really looking forward to the conference that we're going to have in February. I think it's going to be such a great opportunity for people to come together, network, and for us to get to show off a little bit of what we do here at the Eating Disorder Center.